proceed as if we were in morning business for 15 minutes.
Without objection.
I thank the acting presiding officer. Mr. President, I rise today to once again speak out against what I consider to be, and many consider to be, a regulatory assault on our nation's economy. I previously discussed my concerns with regulations having a negative impact on our agriculture community. That was just this last week. And then earlier this week, I spoke about what I consider to be the egregious regulations that are being promulgated by the EPA, the Environmental Protection Agency, or what Senator Grassley calls the End of Production Agriculture Agency. And today I rise to talk about health care regulations that patients and providers have brought to my attention. I've listed a number of these regulations in a letter that I sent earlier today to President Obama, which I ask to be included in the record at this point.
Without objection.
As I have already discussed on the Senate floor, an executive order was issued by the President on January 18. It was a good order. I applauded that order. And it committed all federal agencies to review regulations and then to try to remove any that place unreasonable burdens on our nation's businesses and or impact the ability of our economy to grow, to recover. And I agree that in light of our current economic crisis, establishing a regulatory environment that promotes growth and job creation should be the number one priority for this Congress and administration. And I applauded what the President said when he issued the executive order, that are some that are duplicative, that are costly, unnecessary, and then he said, and downright stupid. And there was loud applause throughout farm country and about all manufacturing, healthcare, education, you name it. But after reviewing the executive order, reading the executive order, I want to remind my colleagues that I was left, and I hope that if you read it, you are left with some larger concerns. Specifically, the executive order left open a number of very large loopholes. It was an executive order without teeth. And when I was in Kansas over this past last work period, I talked to virtually all of our Kansas patients and providers, advocates about the President's executive order and my legislation, which is called the Regulatory Reform of Our Economy Act. And I held a stakeholder roundtable in Topeka, a provider round table in our state capital, to get feedback from patients and providers on their thoughts that are related to health care reform. And I was not surprised to hear that every representative at that meeting had a concern with regulations, but the sheer volume by my staff assistant and myself was truly extraordinary, just extraordinary. I was already aware of the regulations, such as those put forth by the Department of Health and Human Services, along with the Department of Labor and Treasury, that have resulted in the child-only insurance markets effectively disappearing in 20 states. That's the result of over-regulation or over-requirements. And I've already sent letters to the administration detailing my concerns with regulations such as, stick with me now, first, the 2011 Medicare physician fee schedule, final rule, which requires that laboratory requisition forms are signed by the ordering physician. This rule could have potentially serious implications on patient care and business practice. Second, November 17, 2010, CMS, the Center for Medicaid Services, issued a final rule, which, as required by the new health care law, and that's the acronym for that is PPAKA, PPACA, conditions payment for home health and hospice services based upon a face-to-face encounter between patients and their physicians or certain non-physician practitioners prior to certification for home health or hospice services. Now, this is resulting on top of about an $11 billion cut to hospice, which is rather incredible. This is resulting in burdensome requirements for our rural home health and hospice patients. For those who need this help the most, this is truly hard to understand. Third, anti-switching rules. In Medicare's competitive bidding program, The acronym for that is CBP. There's always an acronym for everything. For durable medical equipment, prosthetics, orthotics, and supplies. Specifically, that the proposal to enforce the rule in subsequent rounds of the competitive bidding program, but not round one, may compromise beneficiary access to appropriate diabetes testing supplies and leave beneficiaries vulnerable to pressure from suppliers to switch testing systems. I'm just going to try to get rid of the gobbledygook here and say that during the competitive round, in regards to DME, durable medical equipment, some of the suppliers didn't even know there was a competitive round. In the metropolitan area of Kansas City, there were 424 suppliers. 20 submitted bids this time around. We delayed it 1 year because it was so onerous. And then the next year came around and CMS selected 20. My question is, what happened to the other 404? And what happened to the people who depended on pharmacists and home health care providers for that walker or the crutch or whatever that they really needed, or an oxygen tank for that matter? So we're left with huge holes in the home health care industry and providing DME equipment. Again, I was surprised to hear that every representative at this stakeholder meeting, and I would tell you that everybody was invited, hospital administrators and doctors, obviously nurses, pharmacists, hospital ambulance drivers, hospice folks, and first time they ever met at the same table. And I was surprised to hear that every representative at this stakeholder meeting to discuss the impacts of health care reform had concerns with regulation, some of which are buried in the volume of regulations being put out every day, and many that defy comprehension. When discussing the President's executive order now and regulations with my constituents, those representing the patient and provider community, the number one concern that I heard was a fear not of current regulations, which they're trying to really keep up with, but of future regulations. There is considerable concern with the burden of regulations that have already been issued. I heard time and time again there is an even greater concern with the uncertainty of future regulations, especially those implementing the Patient Protection and Affordable Care Act, or PPAC as the acronym says, and their potential to have further and greater impact on jobs and the economy and health care. Even greater than the impacts we discussed during the health care reform debate. That was we had meaningful dialogue about that bill. This is like the second health care reform earthquake, not a debate. If you are a health care provider, hang on. Additionally, I have heard that the combination of the regulations being issued to implement PPACA, or the statute, have resulted in an increase in premiums. Let me repeat that, an increase in premiums, not costs, savings, for individuals and businesses, which, as you know, or what we all know, results in increased costs and very, very tough choices. Related to this, I'm concerned by reports that I am hearing that staff within the administration have signaled that regulations being issued to implement the PPACA statute already comply with the President's executive order and would not need to be included in a review. Does that mean that all the health care regulations pouring out of CMS are not going to be subject to the President's executive order? What is that? This is one of the biggest worries we have all throughout the country in regards to health care. And the President issues an executive order and said, let's take a look. Do the costs outweigh the benefit? Are they duplicative? Are they unnecessary? Or are they just plain stupid, in his words? But CMS is exempted. Health care is exempted. That's unreal. I believe otherwise, and this belief is being verified by personal stories from Kansans. In my letter to the President today, I strongly encouraged him to review all of the regulations that have been issued past, present, and future while considering their impact on our economy and jobs. Sure, it'd be a slowdown. Sure, it'd be a tough job. It's time. It's time with the Katrina of regulations that are pouring out of the various agencies in Washington. Understanding this last month, I, along with Senator Barrasso, Senator Coates, and with the support of 37 of my Senate colleagues, more by the way, have introduced the Regulatory Responsibility for Our Economy Act, S-358. I urge my colleagues on the other side of the aisle, I'm going to engage you in the next week. You'll get tired of me in terms of the same face-to-face requirements I guess we have to have in terms of hospice. But we'll go face-to-face and I'll try to convince you. My bill moves to codify and strengthen President Obama's January 18th executive order that directs agencies within the administration to review, to modify, to streamline, to expand, or repeal those significant regulatory actions that are, in the President's words, duplicative, unnecessary, overly burdensome, or would have significant economic impacts on Americans. That's President Obama, and I give him credit for saying that. I don't give him credit for the loopholes. While I agree in principle with the President that we need to take a serious look at both current and proposed federal regulations, I just don't think his executive order actually does what it purports to do. I have some loopholes listed. I would only say in Dodge City, where I come from, that coming close to the truth is coming pretty close, but it still ain't the truth. And I think this is where this fits. Let's just listen to this loophole. The executive order states, and I want everybody in the Senate, if you are listening or if our staff is listening, please provide this to the member. See if you can figure this one out. In applying these principles, each agency is directed to use the best available techniques to quantify anticipated present and future benefits and cost as accurately as possible. That's a good thing. That's a good statement. Then it goes on. Where appropriate, however, and permitted by law, each agency may consider and discuss qualitatively, and I suppose those discussions are going on right now as I speak, and this is the part where I had the most concern, and I hope somebody can explain it to me or to anybody. Values that are difficult or impossible to quantify, including equity, human dignity, fairness, and distributive impacts. What is that? Well, the Wall Street Journal captured it so very eloquently in their response to the President's editorial that he sent them. The Wall Street Journal said these amorphous concepts are not measurable at all, and they're not. Mr. President, on the surface, I feel that this language has the potential to be a very large loophole, probably is already. I believe that this is the loophole being used to exempt the PPACA regulations from this review. That's unfortunate. In fact, upon reading and rereading it, it could be better classified, quite frankly, as gobbledygook. My legislation would close, matter of fact, it got my gobbledygook award of the month here this past month, for March. My legislation would close the loophole in President Obama's executive order, the loopholes I should say, and would close other existing loopholes, including those that the administration has been using, or the secretaries of the various agencies have been using, to bypass valuable stakeholder input on regulation, the folks that the regulations impact. In fact, I hear often that patients and providers feel they do not have a voice in the regulatory process. More specifically, I hear that a number of regulations are currently being issued through a shortened process, which allows limited or no input from those most affected by the regulations prior to their implementation. That's wrong. And they may result in an even greater confusion and burden, which then results in greater cost and economic impact, especially if changes are necessary based on later comments that the administration does receive. It is my understanding that the PPACA rules that have been issued as interim final rules, and therefore with limited input, and they'll probably become final, are the National Provider Identifier. That's a number that every provider would have to have. Read George Orwell for that one. Web portal requirements, early retiree reinsurance program, coverage of children to age 26. We don't even have the regs out yet, but they're coming, and you hear a lot about that. Underserved rural communities, that is my attention. Grandfathered health plans, pre-existing condition exclusions, preventive services, internal claims / appeal and external review processes, pre-existing condition insurance plan program, amendment to grandfathered health plans rule, medical loss ratio requirements. That's a bunch of them. All regulations, shortened up. While there may have been instances in which a shortened process was necessary or appropriate, this lengthy list is why passage of my legislation is so critically important. I would ask the acting presiding officer if I've exceeded my time. If I have, I would like 2 additional minutes to close.
The senator has 30 seconds.
May I have 2 additional minutes on top of the 30, and then I can close? And
Without objection.
I thank the the President, the acting presiding officer. In my letter to the President today, I have encouraged the administration to limit the use of this regulatory process and take every available opportunity to get feedback from those who would be most affected by these regulations. That just makes sense. And allow for ample time to review and consider the feedback prior to implementing the future regulatory priorities. We're going to have better regulations if, in fact, you ask folks, hey, is this going to work? And they can tweak it, maybe repeal it, who knows? The President himself said that. In addition, I have encouraged the administration to review any comments you have received on these regulations and that have already been issued for any concerns that indicate a potential to further our economic problems and crises. In closing, I invite my friends on both sides of the aisle, sign on as a co-sponsor of my legislation, realize the immense opportunities it creates for meaningful review and possible revocation of regulations counter to our nation's growth. Thank you, Mr. President. I yield the floor, and I note the absence of a quorum.
Mr. President.
Will the senator withhold?